to do is you have to sign in to a program called Med Skills. Now in the real setting in the hospital, what we're simulating right now is being at the nurse's station. So we're preparing to give meds. We got to see what meds our patient is on, and then we're going to write them down and then research the meds. We never give a med unless we know everything there is to know about that medication. And we also want to make sure we know why our patient is on that medication. So to get started, you're going to open your computer. You click Med Skills, not Meds Manager. We want Med Skills. Med Skills. The username and password is student. So when you log on, for our first practice session, there's going to be a patient named Daryl Blahout. And up here it says to scan the patient's barcode. Now if I was in the patient's room, I could scan the barcode and then the medication, the profile will pop up. But right now we're simulating being at a nurse's station. So I'm going to go to patient, click on this green button here, go to patient, and their profile comes up. These are all the orders for that patient. Keeping things simple, all we care about right now is meds. So on the left side here, it says MAR. MAR stands for Medication Administration Record. We're going to click on the MAR. You click on Medication Fulfillment. And then boom, there's the 4 medications that we have to give to our patient. So I'm going to take note of them. It's going to be aspirin, 325 milligrams, PO, and then I'm going to give furosemide, 20 milligrams, PO, and then I'm going to give Digoxin, 0.25 milligrams, and then there's a little note here. You guys have to be on the lookout for these. The note says to hold for heart rate less than 60. So doctors in the hospital will include that in their order for high-risk medications. Examples of high-risk medications are Digoxin, Coumadin, heparin, and blood pressure medicine. For this case, it says to hold the Digoxin for a heart rate less than 60. All right, now I'm ready to go and research my meds. Okay guys, so I've got my research. I've checked my meds. I've researched them. I got my list here with the right dose. Now it's time to pull the medication. So this is where we're going to do our checks. This is the first check. Your textbook talks about 3 checks. But it gets confusing, so we simplify that into 2 checks. We check when we remove it out of the Pyxis. That's the medication storage device. And then we're going to check them as we individually scan the meds before we give it to the patient. So now you want to click on Meds Manager. Meds Manager is the dispensing device. Meds Manager, not Med Skills. Same login, student and student. And I'm going to go to the top left corner and click Patients. There's my patient, Daryl Blahout. I'm going to click on my patient and my 4 drugs pop up. And I got all my research here. So now it's time to start pulling our medication out. So I'm going to hit Administer. And boom, my drawer pops out. And you look for the green device. So see this little green line? That allowed me to open this one. So now I have my aspirin. So this is how I check it. So my order says here order aspirin 325 milligrams PO once, right now. 325, 325, that's my first one. I got the right patient, it's the right drug, it's the right dose, and it's the right time, right now. We'll close it. Gonna go to my second drug, which is gonna be the Digoxin. Save, close it. Now, insulin, this is a multi-dose vial, and it's a high-risk medication. It requires a cosigner. So in your Aussies or training, I want you to verbalize a cosigner for insulin. I don't think we can simulate that with this system. Always with insulin, it's a cosigner. You would never give this whole bottle. We give only what's ordered. There's 100 units in this bottle, and what's ordered is 5 units. So I'm gonna take this bottle to my bedside, and when I draw it up, as I scan it, I'm gonna administer it at the same time. Hello, my name's Joey. I'm gonna be your nurse today. I'm gonna give you your medications. Just gonna wash my hands first, 20 seconds. Can you tell me your name and date of birth? That's right, Daryl Blahut. Date of birth, yep, that's right. Matches your wristband, matches what I have on file. Do you have any allergies, sir? No allergies? Just gonna check your allergy bracelet. No allergies, good. I'm just gonna sign into your profile and then I'll get your medications ready. Do you have any problems swallowing pills? No, that's good. And I see on your profile that you're not NPO, so it's okay to give you your medication. So I got your profile up here. I logged into the Med Skills program. First thing I'm going to do is scan your wristband. Perfect. And your profile is pulled up. I'm going to go over to the left here and click on MAR, Medication Fulfillment. Okay, good. We got your 3 pills and an insulin injection. I'm gonna check the medication one last time and then I'll educate you as I give each medication. So I'm gonna click on the scan a barcode and just work my way down the list. So the first medication I'm gonna scan is gonna be my aspirin. Scanned it, I'm gonna double check my dose. So I got aspirin 325, it's the right patient, Daryl Blahut. It's to be given now, and it's PO. So all my checks, good, and no allergies. I'm gonna say given. Dose is 325 milligrams, and create. Click on the scan a barcode. My next medication is Lasix or furosemide. I'm going to scan it. All right, let's check my dose. I got Lasix, furosemide, 20 milligrams, 20 milligrams. It's the right patient, it's the right route, and it's the right time. Good. Say given, dose, 20 milligrams, create. I'm going to hit scan a barcode. My last pill for you is Digoxin. Scan the Digoxin. Okay, I have the right drug, it's the right patient, it's the right dose, 0.25, 0.25. It's due now, and it's to be given PO. Oh, what's this? There's a little warning. It says hold for less than 60. Well, I just took your apical pulse, and your pulse was actually 85, so we're okay to give this drug. I'm going to say given, dose, 0.25 milligrams, create. All right, the last medication is your Lantus. This is a long-acting insulin. I'm going to go to scan barcode. I'm going to say check my 5 rights. So I have Lantus, it's the right drug. I'm going to give 5 units. So this is a 100-unit bottle, so I'm going to make sure to only give 5 units. I also know this is a high-risk medication, so I'm going to get a cosigner. It's the right drug, the right patient, the right time is right now. Oh, another warning, it says to hold for blood glucose less than 70. Well, yours was 150, so we're okay. I'm going to put that aside, I'm going to say given. And the dose is going to be 5 units. Can I get a cosigner, please? My cosigner is going to arrive, and I'm going to draw this medication up in front of my cosigner. So I know this is an invasive procedure, so the first thing I'm going to do is put gloves on, because there is a risk for bleeding from the injection. I'm going to start preparing my medication. Swab the top. Get my insulin syringe. My cosigner is here. I'm going to take 5 units of air. I already swabbed the top. Inject the 5 units of air. Invert it. I'm going to pull out 5 units. Tap a little air out of there. Go up to 5. So there's no air in my syringe. I'm going to check it with my cosigner. She confirms. And then she's going to cosign for me. Now, while I have this in my hand, the best practice is to go ahead and give it to the patient. We never recap a needle. Okay, Mr. Blahut, I'm going to give you your Lantus. This is an insulin that's long-acting. It's the kind of maintenance dose for your blood sugars throughout the day. It's an injection that goes in your abdomen. Do you have any questions for me? Okay, just going to swab your skin in a circular motion, avoiding the umbilicus. I'm going to pinch, 45-degree angle, dark motion, hold the tip, pull back. Straight to the sharps container. And my cosigner already cosigned, create. Okay, Mr. Blahut, I have your pills now that I've given you your injection. We'll give you your medication. So your first medication is your aspirin. So you probably are taking this because of your coronary artery disease. It acts as an antiplatelet, which helps prevent blood clotting. And open up the package, put it in the cup. Your next medication is Lasix, and you're taking this because of your congestive heart failure. It's a diuretic that helps remove excess fluid from your body. Some side effects is it can make you constipated, diarrhea, lightheaded. And back to the aspirin, some side effects is you might see some bleeding. You shouldn't drink alcohol with it, it's more risk for bleeding. That one. And then the last pill is Digoxin. Now this drug, we have to be careful when we give it because it lowers your heart rate. You're taking it to help increase contractility of your heart because of your congestive heart failure. We check your heart rate before we give it, and I already checked yours. It was 85, so we're okay to give. Do you have any questions for me? Some side effects of the Digoxin? Yeah, it can cause some nausea, vomiting, lightheadedness as well. Okay, you have no problem swallowing, correct? Okay, I'll give you your medication. A little bit of water.